Your patient in room 35 has a brain mass. Can you tell me which cranial nerves are being affected? Hi, I'm Dr. Rachel Peterson. I'm a neurosurgeon. Today I'm going to teach you how to do a quick cranial nerve assessment. Let's start at the top. Cranial nerve 1 is olfactory nerve, and that's tested by asking patients to smell different items. If you don't have your smelling kit, an alcohol wipe will do. Cranial nerve 2, the optic nerve, is assessed by testing visual acuity and visual fields. Cranial nerves 3, 4, and 6 control eye movement. That's when you ask patients to look side to side, up and down. Cranial nerve 5, the trigeminal nerve, is tested by checking for facial sensation along V1, V2, and V3 distributions. Make sure to touch the patient's face on both sides and ask if there's any asymmetry. Cranial nerve 7, the facial nerve, innervates the facial muscles. This is tested by asking the patient to smile, frown, and raise their eyebrows. Cranial nerve 8, vestibulocochlear nerve, is tested by assessing for hearing and balance. Cranial nerves 9 and 10, glossopharyngeal and vagus nerves, are involved in sensation and motor control of the palate as well as the gag reflex. This is assessed by asking the patient to say ah and checking that the uvula is midline. The sensory function is assessed by touching the back of the throat with a cotton swab. Cranial nerve 11, the spinal accessory nerve, is tested by asking the patient to turn their head and shrug their shoulders against resistance. And finally, cranial nerve 12, the hypoglossal nerve, controls tongue movement. This is tested by asking the patient to stick their tongue straight out and moving it from side to side. Now that you know the basics of the cranial nerve assessment, remember, practice makes perfect. Thanks for watching.